Yeah. Sundowning. So this happens a lot. I think the research says about 66% of the people. Sherry, you think it's more than that?
So many things cause it.
Yeah. So the term refers to collection of agitated behaviors rather than a specific diagnosis. So it's not in the DSM-5. You're not going to find sundowning as having that being a diagnosis. What the experts have learned that age, environmental factors, changes in the brain can raise patients' risk for sundowning behaviors. Proactively reducing risk and creating a plan for managing sundowning behavior could reduce the loved one's episodes. So the research says, keep your house or where they're living, the lights bright in the morning. Do activities, okay, because we want to make sure they're tired at the end of the day. They also, they called it nocturnal delirium. This was first described in the literature of modern medicine in 1941 by a British physician who called it nocturnal delirium. What differentiates sundowning from delirium is associated with behaviors worsening in the evening. Delirium is very temporary. It's usually from a UTI, and antibiotics can cover that. It can be from an infection. It can be from some toxicity. See a lot of delirium in the hospital, especially anesthesia can kind of cause some delirium. But behaviors. I had a little lady do this to me. Well, she didn't do it to me. She did it to the nurse when I worked in long-term care. She used her cane as a weapon. Now, what she did, she had vascular dementia, and she had a rip-roaring UTI, and she wouldn't let the nursing staff culture. She wouldn't TT in her little thing. So, they treated her empirically, but she was having a lot of delusions. So she thought the sprinkler unit was sprinkling gnats all over her bed. And so the LVN, who was trained to do reality orientation, argued with her and said, there are no gnats on your bed. So she gets her cane out and says, yes, there are. You get out of here. Now, thank goodness she didn't hurt her. If you hurt her, then we have to do something about that, right? And that we don't want to send them to behavioral health if we don't have to. So they asked me to come in, and I said, what's going on? She said, I'm in this 2x4 room, which her daughters put her in, and she was appropriate to be there, but she didn't like it and didn't think that she needed to be there. So she had an attitude about being there in the first place. And then I've got gnats all over my bed. I said, you know what? Let me go get the maintenance man, okay? And let's see if we can get this fixed. So I went and got the maintenance man. I said, just go along with me, okay? Introduced him to her, and we went and had a cup of coffee and a cookie, and we came back. And I don't know what it is about vascular dementia, but every person I've ever met can talk excessively. And she talked about cotton farming. Very hard to get away from her, a very interesting lady. I love her. She passed away just recently, but I just got the biggest kick out of her. But the importance of me telling you this story is I validated an unmet need. You're not listening to me, and I stepped in her world. Now, did I have to do that a couple of times? Yeah, I did. But you know what? We didn't have to send her to behavioral health. So that wasn't necessarily sundowning. That was more delirium from having a UTI. But you can also see that with sundowning. Risk factors. Basically, it's in the hypothalamus, a decreased production of melatonin, hormone regulating the circadian rhythm. Okay, that's how they can stay up. And the other thing too, I talk a lot about brain health. Sleep is so important for a healthy brain, but it's also very important for somebody living with dementia. So that's why those activities, having a routine is so important. And being able to get them to go to bed, and because otherwise you're going to have a lot of symptoms of sundowning. Managing risk, light, Turn on lights in the morning, for example, 9:30 to 11:20. You can also purchase light boxes to increase the person's exposure to light. Pain management. A dose of acetaminophen or Tylenol, well, that is Tylenol, at bedtime may help patients sleep through the night without being woken by pain. This is really important because in nursing home, in assisted living, you'll see a prescription PRN, okay, that's as needed. We're assuming that person living with dementia is going to be able to communicate they're in pain. And I think we're doing a disservice if we know they have arthritis, but they may not be able to tell us. Let's get them on a regular dose of this, because that may be another thing to help reduce the sundowning and get them to sleep at night. It could be as simple as pain, but they can't communicate with you that that's what's wrong. Behavior modification, using redirection, reassurance, which is also validation. Distraction that may include a set of bedtime routines that involve soothing sounds or familiar objects. I have a little lady that has a caregiver that rubs lotion on her at night, and that seems to really calm her down, and also the music that she grew up with. It could be using a Bible verse, reading the Bible together if they have a strong faith. Other therapies, aromatherapy, music therapy. I know you mentioned something about aromatherapy as far as dementia care. She's a dementia specialist for Hospice of East Texas. Sleep hygiene, reduce caffeine and sugar later in the day. Now, that's something else. How many people caring for somebody with dementia, all they want to do is eat sugar? Okay, so what's happening is it affects taste, and the taste buds that are still working are the ones that like sugar. So it becomes really challenging for a diabetic who all they want to eat is sugar all day. So that's what's going on there. But avoid television before bedtime. This is huge, especially something like Fox News or CNN. There's so much negativity. There's on cable, Suddenlink, or whatever it is now, Altice. There's Channel 2, We TV. It's got Me TV. Okay, I Love Lucy, Logan's Heroes. Those are really good shows that are good. They're funny. And they can watch them over and over again, but sometimes people living with dementia, when they watch the news, they think the events is actually happening to them. So that's why we want to redirect to something else. Yeah?
A quick question back to the lighting. So I have learned over the course of the last 8 or 9 years that with the sundowning, it can be the atmosphere changes as well, lighting and so forth. It's very interesting about, you indicated our lighting from in the morning.
Mm-hmm.
So is that so? I've always thought and learned that turn the lights up near the evening as that lighting change is happening to help with sundowning. So explain to me, and I'm not saying what I'm saying is I love that and would like to know more.
Well, I think you could try both. Okay, I mean, once you've seen dementia on one person, you've seen dementia on one person. So, try it throughout the day. This is what this research says. Yeah.
Because then you can't get them, and then it's
when you want them to do activities. Yeah, you want them to do activities, and you want to keep them in a routine so that, and that's part of that sleep hygiene, so they can go to bed and not wake up. Now, I'll give you another example of sundowning. I have a little lady that she's now in a community, but her husband's been coming in for about 4 years. This was about 2 years ago. Again, a man, nothing, I love you guys, but he just wanted to vent. He didn't want to listen, which is okay. I'll listen. But finally one day I said, this isn't working for you, is it? He's like, no, it's not. And I said, why don't you try to step into her world? Okay? He says, man, that's crazy. I said, well, it's worth a try because this other stuff's not working. So what was happening, she was waking up at 2 a.m. She has Alzheimer's. I want to go home. And he's arguing with her saying, you are home. and started to show all the pictures in the house. Don't you remember? Well, no, she doesn't remember because she doesn't think she's home. So this was his idea, not mine. He actually got really good at this. He said, sweetheart, get your purse and I'm going to take you home. So he drove her around the block, come back, turn the bright lights on to the very home that they just left and said, sweetheart, you're home. And she goes, thank God. Now, the reason why this story is so important, bless his heart, he was waking up at 2, trying to convince her for hours and hours. And she was throwing plates at him. I mean, it just got crazy. Well, he was able to go back to bed around 3 o'clock. That's why this story is important, because of the caregiver's health. Conclusion, sundowning is a common clinical phenomenon in people living with dementia and a significant challenge for families and caregivers. Evidence suggests the circadian rhythm is the disturbance. Does that make sense? Okay.